Hello, and thank you for attending this virtual roundtable to discuss this disproportionate impact the COVID-19 pandemic is having in Indian country. I thought it was important to hold this discussion with policy experts as a follow-up to the roundtable that Chairman Grijalva had with tribal leaders last month discussing coronavirus in Indian country. Since the beginning of this crisis, we have seen tribes suffer worse economic, social, and health consequences from this virus compared to non-tribal entities. Much of the reason for that is the federal government's historic failure to uphold its trust responsibility. That includes the failure to provide sufficient healthcare, to invest in infrastructure, and to provide opportunities for education and economic development. That failure is now costing more lives than ever. The Navajo Nation has one of the worst outbreaks in the country and have lost more than 120 of their brothers and sisters. Some western states like New Mexico, Wyoming, and my state of Arizona, Native Americans make up a disproportionate number of positive COVID-19 cases. Tribes also suffer outsized economic harm due to COVID-19, because without revenues from their businesses, tribes have no funds with which to provide essential government services. These inequities are felt even beyond the borders of our reservation. For example, urban Indians in places like Phoenix face their own unique challenges in gaining access to care. As our panelists here know today, this proportionate impact isn't new. Indian country also suffered more than any other Americans during the H1N1 pandemic and the Spanish flu pandemic a century ago, also because of federal government failures. That is a shameful history that we must change as we face down the COVID-19 pandemic. Unfortunately, even though Congress passed over $10 billion in relief funding for Indian country in the CARES Act, rollout of that package has been plagued by mismanagement and delays. Tribes have waited too long for this money to be released. They have to go through some burdensome application process and even fight in court to receive the relief they're owed and we voted for. This is unacceptable. Members like myself and my colleagues participating here today have fought every step of the way for this administration and Congress to keep their promises to tribes. That's why I'm proud to be voting today for the HEROES Act, which fixes the CARES Act implementation problems created by the administration and which would inject over $25 billion into tribal governments and health systems. But our job is nowhere near done. The HEROES Act is not yet law, and there are still many provisions of the CARES Act that have yet to be implemented fully. I am hopeful that our discussion with these experts today can help illuminate some of the challenges tribes face in fighting the pandemic and inform us of some of the shortfalls of ongoing aid efforts. Thank you all for joining us and for engaging in this discussion about how to best uphold our trust responsibility to Indian country. With that said, we'll move into presentations from our panelists. After a short introduction, each panelist will present for about 5 minutes. After all panelists are done, we'll move into question and answer discussion format. We'll start with our first panelist. Kevin Ellis is the Chief Executive Officer of the National Congress of American Indians. He is our first panelist. NCIA is the oldest, largest, and most representative organization serving the broad interests of tribal nations and their citizens. Mr. Ellis has years of experience working in Washington, D.C. as both an attorney and government relations specialist. Prior to joining NCAI, he was Thunderbird's strategic president and chief executive officer. He also previously served as executive director of the Native American Contractors Association, a nationally focused organization that advocates for issues focused on tribal business and economic development efforts. Mr. Ellis is a tribal member of the Forest County Potawatomi community. Thank you for joining us. You may begin.
Thank you, Mr. Chairman, ranking members. Great to be here. On behalf of the National Congress of American Indians, I want to thank you for holding this forum. As mentioned, my name is Kevin Ellis. I'm a citizen of the Forest County Potawatomi community in Wisconsin and Chief Executive Officer of NCAI, which, as you mentioned, was founded in 1944 and remains the oldest and largest representative organization serving the broad interest of tribal nations and communities. As we see the infection rate and death toll of COVID-19 pandemic intensify, it's clear that American Indian and Alaska Native communities are disproportionately impacted due to a chronic underfunding of the federal trust and treaty responsibilities. While we are grateful for Congress's support of Indian country and the CARES Act, distribution of those critically important funds have been late due to deficiencies in tribal consultation, sluggish interdepartmental cooperation, and the imposition of non-statutory barriers to access funds. Further, despite this investment, Indian country's COVID-19 needs are growing. Today, I'll spotlight Indian country's critical health and infrastructure needs to respond and cover from this pandemic. Presently, there are at least 130 reported COVID-19 deaths in Indian country and almost 6,000 positive COVID-19 cases in the Indian health system, which consist of Indian health services, tribal health programs, and urban Indian organizations. Despite the federal trust and treaty responsibility, the system is chronically underfunded at the expense of the health and lives of American Indians and Alaska Natives across the country. We are grateful for the $1 billion in IHS funding that Congress provided in the CARES Act, but unmet needs have been estimated to be close to $32 billion. Accordingly, we strongly support increased funding for the system that includes emergency third-party reimbursement relief fund and technical Medicaid, Medicare fixes, such as the authorization of Medicaid reimbursements for qualified Indian provider services and urban Indian organizations. Lastly, it is critical that Congress support programs that address many of these disparities, health disparities, which increase tribal vulnerability to COVID-19, such as by permanently reauthorizing the successful special diabetes program for Indians. We talk about infrastructure, housing. According to HUD, the lack of housing and infrastructure in Indian country is severe and widespread and really far exceeds the funding currently provided to tribes. Tribal communities experience an overcrowded home situation of 16%. That's roughly 8 times the national average. These inequities have been exacerbated during the pandemic and threaten tribal health and lives as families have difficulty social distancing or quarantining in overcrowded housing. I would like to thank our congressional partners for recognizing this need by including $1.99 billion in emergency solution grants to tribes and tribally designated housing entities, and for the $3.75 billion for tribal homeowner assistance for eligible NAHASDA recipients. We ask our partners to ensure these provisions are retained in the final negotiated package. Roads. According to a GAO report, 93% of tribally maintained roads and 75% of BIA maintained roads are unpaved. These roads are some of the most underdeveloped, unsafe, and poorly maintained road networks in the nation. Poor road conditions in Indian country make it difficult for health personnel and first responders to reach tribal communities. While we appreciate the HEROES Act's inclusion of funding for the Tribal Transportation Program, the $150 million appropriation is significantly less than the $1 billion that is needed to address immediate TTP transportation access needs within the next package. Telecommunications. According to a GAO report, only 65% of individuals living on tribal lands had access to fixed broadband, in contrast to the access rate of 92% for all Americans. Within education, the National Center for Education Statistics has found that 36% of Native students nationwide did not have internet access in their homes, compared to 18% of students nationwide. During the COVID-19 pandemic, these inequities have impaired tribal access to relief, impeded health delivery, reduced educational opportunities for tribal youth. While we would appreciate the HEROES Act inclusion of $140 million for IHS expansion of broadband infrastructure and information technology, more is needed. Congress must not leave Native youth behind. Tribal organizations are united in their ask that Congress provide $115 million for wireless hotspots for students and teachers at the Bureau of Indian Education funded schools, and $60 million for laptop equipment to ensure our children are able to access distance learning. Finally, additionally, tribal set-asides and match waivers are needed in USDA broadband programs to ensure tribal access. Further, it is critical that Congress support the Tribal Broadband Fund and the Federal Communications Commission to facilitate rapid deployment of broadband infrastructure across Indian country. Lastly, NCAI strongly supports Representative Holland and Cole's bill, H.R. 6819, which improves emergency special temporary authority for unassigned spectrum. This bill builds off the successful extension of this authority to the Navajo Nation, Pueblo Zuni by FCC to address urgent tribal needs. Again, thank you very much for holding this forum, and I look forward to answering any questions.
Excellent, thank you. Thank you, Kevin, and for your work on the ground. The next panelist we'll hear from is Dante Desiderio, the Executive Director for the Native American Finance Officers Association, NAFOA. Established 35 years ago, NAFOA is a national nonprofit organization providing leadership for the advancement of independent American Indian and Alaska Native sovereigns by providing essential information and resources to meet the challenges of economic growth and change. Prior to joining NAFOA, Dante served as the Director of Economic Policy for the National Congress of American Indians. Dante, prior to entering Native policy, served in diverse capacities within financial services and investment management industry, including as a trust officer in a national bank and an investment and risk management officer in a large regional bank. He also successfully implemented a financial services program, the Department of State, through the credit union. Thank you for joining us. You may begin.
Thank you, Chairman, and thank you, committee members. Biwan Bilahuk. My name is Dante Desiderio. I'm a member of the Subcommittee, a Siouan tribe of the East located in the highlands of both Virginia and Carolina. I'm also the Executive Director for NAFOA, and I want to thank you for hosting this important forum in the middle of what's considered one of the worst health emergencies and economic downturns that we as a nation have experienced in over a century. Indian country in particular has suffered a great deal during this crisis. So each morning I comb through all the news stories and see how Indian country is doing during this crisis. And the news is not good, especially for those tribes that have been impacted by the disease and are trying to contain it. Just 2 days ago, the state of New Mexico reported that half of all deaths reported in a single day were from the pueblos and the nations in that state. I also see news stories about our tribal efforts and national efforts to deal with the crisis showing up in other parts of the world. China printed a story yesterday. Italy reached out early. They were concerned that the same factors of multi-generational households and high social factors would impact tribes in a similar way that the coronavirus impacted Italy. And they were right. And of course, the heartwarming story of Ireland paying back a debt to natives from when the Choctaw helped Ireland in the 19th century during the potato famine. So with Indian country feeling the health and economic impacts of an unprecedented crisis with the nation and the world watching, how are we doing? More specifically, how is the federal government doing during this time to help tribal governments? How have they risen to the moment? So I'll start with Congress. Congress deserves to have their role recognized in this moment. In a bipartisan fashion, Congress did its job by making sure Indian country was included in the laws that were passed to deal with the health and economic impacts of the coronavirus. There were key wins for Indian tribes in the legislation that was designed to mitigate the impacts of the crisis. First, Indian tribes were included in a lot of the provisions with the understanding that our communities needed to be a part of just about every part of the relief effort. The second was that tribal governments were specifically included in discretionary coronavirus relief funding, Title V, in a similar manner as states. So I believe this is a first for Congress. And third, tribal governments were rightfully included with states and municipalities in debt relief. Again, a first for Congress. So the legislation was a clear recognition that tribal governments as sovereigns should occupy a responsible role alongside other governments in preventing, mitigating, and addressing the impacts of the emergency, including managing the health, education, and governmental impacts. All of this begs the question, if Congress did its job, why are funds still tied up? Somehow, between the clear legislative language and the floor statements further clarifying intent, some agencies interpreted the language in creative ways, or they failed to establish prior relationships and funding mechanisms that would help tribes during the crisis. So it's no longer acceptable that key agencies are still unfamiliar with tribal governments and the unique, and the unique government-to-government relationships that have existed for hundreds of years. As someone on our NAFOA team put it the other day when she was describing this time before our Organization for Indian Country, she said, "I don't know how to describe it, but please don't say we're being resilient. We've been resilient for 500 years. We're tired of being resilient. We need people to get it." So that the Small Business Administration decided to interpret any tribal business concern, language that was designed to include all concerns, They interpreted it to mean only what they thought was appropriate. As a result, tribal entities were excluded until the Friday before the announcement for the second round of funding, placing them at a disadvantage when applying for and receiving funds. The Federal Reserve Bank, despite clear legislation, decided to place tribes in the business section, the Main Street Fund, instead of in the government debt relief section. Now tribes are stuck with the Fed trying to figure out how rules for businesses will work for tribal governments and their entities. This includes banks already refusing tribes for the program because the tribal entity may send money to the parent company. In this case, that would be the tribal government, which is the reason that the tribe owns the entity in the first place. Tribes have economic enterprises instead of a tax base for funding tribal government operations. As a result, tribes may be stuck with enormous amounts of debt with no way of working things out, while other industries and entities get relief. Adding to the severity of the situation, tribes are not eligible for bankruptcy either. We're hoping Congress will continue to substantially include Indian country and fix some of the issues created. And we're also hoping that agencies will become resilient in their determination to get things right with tribal governments. Thank you for allowing me to make these comments and for your support for tribal governments.
Thank you so much. Thank you again. Our next panelist is Walter Murillo, President of the National Council of Urban Indian Health Centers. Mr. Murillo is a member of the Choctaw Nation of Oklahoma and has been at Native Health in the Phoenix area for over 21 years. It's a great organization. Thank you again for all the work you do. He has been the Chief Executive Officer of Native Health since 2010. Native Health provides culturally competent primary care along with behavioral health, dental, WIC, nutrition programs, home visiting programs, and a literacy initiative. Under Mr. Murillo's leadership, the health center has added 3 sites and became a staple of the community in my congressional district. He's currently on the board of the Arizona Alliance of Community Health Centers and serves on many committees and in leadership roles. Thank you for joining us today, Mr. Murillo. You may begin your story.
Thank you. Thank you, Chairman Gallego and committee members. Thank you for inviting me to speak on behalf of Urban Indian Health Organization. My name is Walter Murillo. I'm a member of the Choctaw Tribe of Oklahoma. I currently serve as the president of the National Council of Urban Indian Health, NCUI, which represents 41 urban Indian organizations across the country. We would like to express our gratitude to the Committee on Natural Resources for their tireless effort in ensuring that all of Indian country has the resources needed to protect the care for our relatives during this pandemic. We appreciate your commitment to ensuring that 70% of American Indians and Alaska Natives residing in urban areas have access to critical health care. There's more work to be done, and we look forward to working with our elected federal representatives in Congress on ensuring that the HEROES Act and other future legislation provides urban Indian organizations resources they need to address this crisis. There are many stories and challenges and successes in UIOs across the country, and I can speak specifically about my experience as the CEO of Native Health in Phoenix. Almost immediately, we moved to telehealth with the authorities granted for telephonic visits for medical and behavioral health care. We've also done that with WIC. We've seen an increase in our demand for behavioral health services, highlighted by a 3-fold increase to our domestic violence program requests. We've had to close our dental clinic to all but emergency visits. We're experiencing an increase in demand and services for programs that are considered addressing the social determinants of healthcare. Our food program has had to quadruple. Our employment program has had many requests. We also face difficulty in housing. We experience the same problems in gathering PPE and testing kits as many other healthcare providers. Despite the expanded ability to provide telephonic visits, as I said earlier, the reduced number of overall visits and the closure of the dental clinic, half of our total budget is comprised of third-party revenue. Many other UIOs who depend on third-party funds to a greater degree and whose numbers have dropped more dramatically are suffering a great deal more than us here in Phoenix. Since May 2nd, we have partnered with the Arizona Department of Health Services and the Arizona National Guard to conduct free COVID-19 testing as part of the statewide coronavirus testing blitz. As Congress continues to address the response to the COVID-19 pandemic, NCUI would like to highlight the 2 top priorities for urban Indian health. The first is parity for urban Indian organizations as part of the IHS system. And secondly, funding for urban Indian organizations that extend beyond the single line item for authorities granted but unfunded in the Indian Healthcare Improvement Act reauthorization. UIOs are an integral part of the Indian Health Service healthcare delivery system. And across the nation, there are 41 UIOs that operate in a network of 74 health facilities across 22 states, providing primary care, behavioral health care, dental care, social services, inpatient rehabilitation for alcohol and substance abuse, and traditional services as well. UIOs are ineligible for some of the same essential cost savings measures for which IHS direct care facilities and tribal health programs are eligible. It is our belief that UIOs have been excluded mostly due to unintended oversight and legislation. The COVID-19 crisis has highlighted the urgency of rectifying those long-standing inequities that UIOs face. From day one, UIOs have been on the front line battling for PPE and testing kit shortages while continuing to provide services. These sudden challenges compound the difficulty in providing those services when combined with the chronic underfunding and funding and infrastructure gaps the UIOs already face. The facility in San Jose, California, for example, has had a 13% positive rate. UIOs were not allocated any Abbott rapid testing machines from the IHS or FEMA and had to fight for any testing capabilities at all. As our health workers are risking their lives every day, we need the federal government to ensure that our frontline heroes receive the same protections as all other public health employees. It's essential that Congress act on critical policy fixes for UIOs, including parity in the 100% federal medical assistance matching percentage, or FMAP, coverage for reimbursement for providing care to urban Native American veterans, and medical malpractice coverage via the FTCA, all of which would enable UIOs to utilize and leverage their scarce federal resources and provide more health care to more patients. These savings requests and technical fixes are necessary to provide our health system with much needed resources to protect patients and communities during this pandemic. A recent survey in March found that 83% of UIO respondents have been forced to reduce their services. Distancing guidelines tell us more than ever that proper capacity in essential facilities such as healthcare is necessary. UIOs don't have access to funding under IHS facilities budget line item and also don't have access to COVID-19 funding designated for facilities appropriated to the Indian Health Service. Now with that pandemic, it's more urgent than ever that we be able to modify facilities, add additional module units for inpatient rehabilitation services and others. These requests are essential to ensuring urban Indians are properly cared for, both during the crisis and critical times to follow. It is the obligation of the United States government to provide these resources for American Indians and Alaska Native people residing in urban areas. The trust and treaty obligation was addressed in the Indian Healthcare Improvement Act, and we urge Congress to take this obligation seriously and provide UIOs with all the necessary resources to protect the lives of the entirety of American Indian Alaska Native population. We urge the Congress to explicitly include UIOs in legislation where the whole Indian healthcare system, ITU, is meant to benefit. If Congress ignores these critical policy fixes in future legislations, many American Indians and Alaska Natives will be left without adequate health care simply based on their status of living off the reservation. Thank you for your time, and thank you for this opportunity.
Thank you, Mr. Murillo, for sharing your story with us. We will now go into our question and answer session. Each member will take 5 minutes to ask questions, and then we'll open the floor for more discussion. I'll start with my questions, and we can have a 5-minute round of questions and have deeper discussion after that, depending on our timing. I believe staff, will you be monitoring the times? I don't have a clock on me here.
We can monitor time in the background and announce when 5 minutes are up.
Thank you. Appreciate that. Let's do that. Let's start with Mr. Alice. In your organization's opinion, what implementation level fixes are needed to make sure future congressional relief projects and packages are readily accessible to tribal nations? Mr. Alice?
Let me unmute. I'm sorry.
Okay,
Can
go
you
ahead.
repeat that question again, Chairman?
Sure, and we'll start as soon as I finish the question. We're not going to count mute time for the 5 minutes, okay? In your organization's opinion, what implementation level fixes are needed to make future congressional relief packages readily accessible to tribal nations?
So from our standpoint, what we've seen in the last bill and where all the delays have been for some reason, as Dante referenced earlier, questionable interpretations of what the language in the bill was signaling. Again, so we would hope to see, some of the clarifications in the the next bill or two bills that clarifies some of the situations that we're seeing that's causing money not to get out. I mean, it was very clear with the government relief funds that the money had to get out within 30 days, who it was supposed to go to, problems there. Dante alluded to PPP issues, so just kind of zipping that up a little bit and making sure that they can't wiggle out of honoring the trust and treaty responsibilities that Congress intends in these bills.
Thank you. So the implementation of CARES funding has been overwhelmed with delays that has harmed tribal communities. Outside the Coronavirus Relief Fund, are there other tribal funds still waiting distribution?
Yes, and is that question for me?
Yeah.
Yeah, so there are several. One of them has to do with education. Congress appropriated $69 million for TCUs, BIE funded schools, including those that are tribally controlled. On April 15th, we did get some notification that 46 million was going to go out, but 46 million doesn't equal 69 million. So there's been a slow roll there. In addition, there was 153.75 million set aside through the Economic Stabilization, Education Stabilization Fund. And there have been listening sessions conducted by education, but there has been no word or information on when that money will be coming out in hitting Indian country.
Good.
Just one example.
Appreciate that. Let's move on to Mr. Murillo. You mentioned that at the start of the crisis, urban Indian health organizations did not have access to the resources that they needed to combat the pandemic. What have urban Indian health organizations had to do to compensate for this unmet resource?
Well, we ran into difficulties early on with the inability to access equipment and stuff and other supplies from the National Service Supply Center. IHS did offer us assistance in seeking assistance from the state and counties. But as our experience is, we become very low priorities when measured up against local urban hospitals. And so it's been very difficult. We've really been scrambling on our own from our existing providers and others to get needed supplies and testing. We rely on LabCorp and another private corporation lab to get those needed testing materials. So we've been on our own. We've had some assistance from Indian Health Service, but I think another glitch in the law has prevented them from allowing us to access the National Service Supply Center for those essential testing equipment and equipment that we need.
What health provisions are missing from the HEROES Act that you would have liked to have seen for urban Indian organizations?
Well, we would have liked to have seen the bill just introduced by Representative Mullen, HR 6535, which would provide FTCA coverage for UIOs. We're also hoping that the 100% FMAP provision would be permanent and extend only to UIOs. However, we're extremely supportive of the funds that the UIOs and the fix for the VA as well. And I want to thank you, Chairman Gallego, for your spearheading that, allowing Native American veterans to access urban Indian health programs for care.
Let me make sure I'm running out of time. Mr. Desiderio, did the population formula used by the Department of Treasury effectively distribute funding based on the needs of tribes? And were tribes satisfied with the level of funding they received thus far, at least?
So the population number, just to get quickly to the answer to that question, is no, tribes are not satisfied with the use of the population number itself, the data that was used to come up with the population, and then two, the amount of funding that was distributed, or I should say distributed in an equitable manner. So we're left with this.
And the study, why don't you break down, like, what did you not like about the population formula? And then we could kind of, and then we could go after that, then moving to distribution funding.
Well, the population formula itself used a housing and urban development, the HOSTA formula, that was based on the service population of the tribe. There was some tribes who don't use that program in HUD and haven't challenged those numbers in a long time. There was quite a few tribes that came up with the number 0 for their tribal populations, which should be immediately rectified. It has not been yet. So we're hoping Treasury does that. So those population numbers also for those tribes that have lower populations and a very large impact for economic development, those tribes were not considered, or their amount of distress based on this coronavirus crisis is not close to being met with the population distribution.
And then that, of course, affects the distribution funding.
That does. So we're still waiting on the 40% to come out and include some of the economic components and also some of the other additional funds that are needed for population that wasn't included in the enrollment numbers for tribes that to cover some of the impacts. So the employment numbers, we're hopeful that that will include some of the economic impacts, and then they're looking at tribal expenditures and the ability for tribes to put in for other funds that are needed. So we're hoping that Treasury applies a bit of flexibility to that and understands the dilemma that tribes are in now.
And lastly, are tribes being adequately accommodated by the credit facilities at the Federal Reserve?
Yeah, this has been a really interesting experiment. This is the first time we're being included in credit facilities. We've worked with the Minneapolis Federal Reserve, who's been the Federal Reserve Bank that's been charged with helping out Indian country. The facility itself, we were on a really good track with trying to talk with the Federal Reserve Bank about all the tribal needs. We put in a lot of comments for that, but then we were placed in a Main Street fund, which is a fund for businesses, not a fund for governments. And this is really disturbing because there are limitations on that funding, and it only includes the tribal side of that, and tribes have debt both with the government and with the business side of things, and it's forcing tribes into an awkward situation. And the other part of that is that Main Street Fund is limited. It goes up to $250 million. It doesn't take into consideration the real impacts for tribes, or a lot of tribes that have larger amounts of debt. So the feeling right now is that tribes are going to be stuck with a lot of this debt and not have any way to really take care of that, just like every other entity, including other governments that have a chance to really renegotiate that debt, get loan guarantees, or have the Federal Reserve buy that debt and free up money for banks to be able to help tribes going forward.
Great, thank you. Let's, I believe, from looking what I have, and staff correct me, our next member to ask questions is Representative Holland. Is that correct?
That's correct. Ms. Holland, you have 5 minutes.
Excellent. Okay, thank you, Ms. Holland.
Thank you. Thank you, Chairman. Thank you for having this hearing, this meeting. And thank you all to the panelists for joining us today. Your voices are extremely important on this issue, and I'm very grateful that you've taken the time to be with us today. Thank you for the work that you and your organizations have done with all of our offices to help move Indian country priorities forward during this national pandemic, since our voices have historically been left out of the conversation when it comes to national issues. Today, the state of New Mexico published statistics showing that 58% of the statewide coronavirus cases are Native American, even though the state population of Native Americans is 11%. That's over half of the state's cases, which is obviously disproportionately impacting tribal communities more dramatically than other groups of people. And I'm sure these are similar numbers that folks are seeing in other states as well. Further, the Navajo Nation has reported that they have more COVID-19 cases per capita than any other place in the United States except for New York and New Jersey, yet has struggled to receive national attention up until a couple of weeks ago, only when a disproportionate amount of tribal members were being impacted. And so this brings me to my first question for Mr. Ellis. Mr. Ellis, how has this lack of funding, and you may have already addressed this, but perhaps I'm going to ask in a different way so we can delve more into the issue. How has this lack of funding been exacerbated by chronic infrastructure issues, right? The lack of the chronic underfunding of infrastructure. Broadband connection is an issue that I'm focused on since Indian country has connection rates in some locations as that of third world countries. So in the COVID-19 Disaster in Indian Country Act that I recently introduced, I proposed the deployment of emergency spectrum access so tribes can set up their own networks to help save lives and provide educational services to their students, which are largely absent right now. Congress has never given tribes direct access to spectrum over tribal lands prior to this bill that we're moving. Will you please explain why tribes need direct access to spectrum for wireless networks in Indian country and why this lack of spectrum access has continued to leave tribes behind in this digital age, thus causing a greater rift in the digital divide?
Thank you for that question, and we thank you for your attention to this serious problem. Many of us, as we work and go through our day-to-day activities, could never imagine what life would be like without constant communication and access, to information, to people, and to resources. I always, try to get people to think of how they feel when they're on an airplane flying over water or the internet is out, and how uncomfortable that is for the maybe 2 hours that you have while you're in the plane. Well, it's like that in Indian country 24/7 and completely unacceptable. When you don't have access to the broadband, you talk about education. And we know that rural Indian country, only 46% has connectivity with the broadband. That means more than half of the area is not covered by that. So kids that are no longer in school because the schools are closed because of the pandemic, unlike kids outside of Indian country, can't access the classroom in a meaningful way that keeps them at the front of the class and at the head of the curve, and puts them further behind the curve in not being able to get the education that they deserve. You also have public safety. A lot of people don't think about this, right? I mean, you have an infrastructure system with detention facilities that's deplorable to begin with. Almost 30 of these facilities are in really poor shape, and they certainly don't have this kind of technology. So when you have a telework situation and you have the criminal justice process that needs to continue, you need to have telehearings, what we're seeing in other jurisdictions outside of Indian country, and we don't see that. So certainly that has an impact on the safety in our community. And finally, telehealth. Recently, I had a appointment with my doctor, and it was through technology, and given the lack of that in Indian country, and then on top the long distances that many tribal members have to travel to get to a facility is another serious problem, and digs a hole deeper for us.
Thank you for that detail. Mr. Ellis, will you also please explain, and now I just have a few more minutes left, and I'd love to get on to another question, but can you also explain why funding like the USDA Tribal Set-Aside that I included in the COVID-19 Disaster in Indian Country Act is especially important for tribes because they have experienced barriers to accessing spectrum?
These are enormously important programs. They provide financial assistance to develop the physical and equip the physical and equipment infrastructure needed to deploy broadband and technology to rural countries. Tribes are eligible, but as you know, they're required to compete with other larger governmental organizations and entities. In addition, there's matching requirements that also pose a hurdle. So we really need, Congress and our champions like you to address, those situations that are roadblocks and hurdles for tribes to actively and effectively use these really important programs that you identified.
Thank you. Thank you. And I'll have one last question to Mr. Desiderio. Will you please discuss the funding issues that Indian country has encountered with the CARES Act $8 billion coronavirus relief fund? I understand that only 40% of the funding is yet to be released, and this has severely exacerbated the crisis, especially since the U.S. government has only spent about $2,800 per person for healthcare in Indian country versus about $10,000 for the rest of the country.
Right. So this is May 15th. The deadline for distributing the funds was at the end of April, and we're still waiting for the other 40% to be distributed. So the delay, the first round of distribution, the 60% based on population, did not go out until after the deadline. So I think there was a lot of issues on Treasury trying to manage the interpretation of the fund. From our understanding and working closely with Congress, the fund was supposed to be going out to manage the healthcare impacts, which were really important. And I think tribes, like we see with Navajo and other tribes, really need that money early. But the interpretation from Treasury went from what was very clear in the law for expenditures for both tribal governments and their entities to going into other factors. So it's now winding its way around to Treasury sending out a notice just today on what their next considerations are going to be. So it's not going to be until June until tribes get that money. So with the lack of adequate healthcare funding that you're bringing up, the inadequacy between the general population and the Indian population, it really is exacerbated during this crisis. The funding levels, not just for healthcare or for this coronavirus relief fund, but we also need funds for, like Kevin is saying, telecommunications. We need funds for housing and some of these other things that are now in the spotlight for Indian country, these inadequate infrastructure that's being brought out by this crisis. So the healthcare is one example of other things that have been magnified during this crisis.
Thank you so much. Chairman, I think I'm about out of time. Is that correct?
I believe so, but I think we're going to have second rounds of questions. So if you have anything left, Leader, then you'll be able to get some in.
Thank you. I'll yield here then, sir. Thank you.
Excellent. Thank you, President Holland. And now we're going to move on to Representative Cartwright.
All right, can you hear me?
We can.
Well, good afternoon. I'd like to start off by thanking our chairman, Gallego, for hosting this important roundtable discussion today, and certainly the subcommittee staff for all their hard work that has made this possible. Sorry, I couldn't get my system to do anything other than give me audio access, but I've been listening intently. Of course, I'd like to especially thank our distinguished panelists, Mr. Alice, Mr. Desiderio, and Mr. Murillo for joining us today. This COVID-19 pandemic stands as one of the most severe trials of our republic. I know the pain and fear that this disease can bring. I represent a district in northeastern Pennsylvania that has been badly affected with more than 5,000 cases and many hundreds of deaths. And tragically, as my dear colleague, Congresswoman Holland pointed out, coronavirus has hit parts of Indian country even harder. As she said, the Navajo Nation ranks right up there with New York and New Jersey in the severity of its outbreak. Many other Native communities are working to contain and prevent the disease, even as their major sources of revenue have been weakened or shut down. It's a situation that recalls troubling precedents. There was a recent article in Indian Country Today that noted that during the 1918 influenza pandemic, mortality rates were 4 times higher for Native communities than for the wider U.S. population. We in Congress have to do everything we can now to avoid repeating that ignominious outcome. Mr. Alice and others on this panel have said elsewhere in the unique challenges of Indian country that they require special attention. As a member of the House Appropriations Committee, I want to say I have worked hard to secure greater funding for Indian country, which has been chronically underfunded for decades. And now, in these difficult times, the need for federal investment is even greater. Our response has to be equal to the need. I fully understand the importance of honoring agreements. I'm a lawyer. The federal government has undertaken many obligations and trust responsibilities as part of its government-to-government relations with recognized tribes. Our response has to respect tribal sovereignty and grant flexibility necessary to fight this pandemic. And we have to ensure that agencies carry out the clear intent of Congress when we pass acts granting relief. So I want to learn a little more about the situation. Mr. Desiderio, during this emergency, what flexibility do tribal governments and federal agencies need to best use federal aid, and how are the current rules placing barriers to using federal aid?
Well, first, I want to send our concerns and thoughts to your district. I know you all are having to deal with a lot in northeastern Pennsylvania. Have family not too far from there. But also, I think you hit the nail on the head here when you're looking at how agencies should be interpreting this. Everyone came out of these laws being passed with the impression that Indian country was going to have the flexibility to really deal with this crisis. And what's happened since is a lot of barriers have been thrown up. So the agency should be opening up how tribes are being accommodated in the crisis. So looking at things in the Coronavirus Relief Fund, Title V of the Act, which is really supposed to be discretionary, and having tribes be able to use those funds for a lot of different things that the other provisions in the law had not accommodated. And I think we're coming out of this first couple of rounds of funding with the idea that this is going to be a restricted use of funds. The idea that we don't have the economic enterprises to support government functions means that, unlike states where you get a dip in tax revenue, tribes have had their government revenue completely stopped. So we need flexibility in being able to provide employment relief, payroll relief. We need flexibility in trying to make up for those revenues. It's not lost revenue for the businesses. This is lost government revenue that we're unable to fund these ongoing government operations at a time when we have increased responsibility in trying to take care of not only our people, but there is an obligation and a responsibility that tribes feel in taking care of their surrounding communities. They do take the idea that they're good stewards of their communities seriously and have wanted to help in this crisis, those specific communities, and they've been restrained from doing so. And in some of the other provisions on the PPP funding, for example, the SBA had come up with strict interpretations that kept us out of the entire first round and didn't let us in until the Friday before the second round of funding. So those things are really unacceptable. There should be a lot more flexibility and the understanding that tribes do know what's best for their communities, and they can come up with these solutions on their own.
And my last question, Mr. Desiderio, also for you, I wonder if you could speak to how Congress can best support tribal governments during this time, given that tribal debt is largely issued by private banks rather than issued on the bond market? And what alternatives are there for Congress to ensure that tribal governments receive support during this time?
Yeah, and this is no fault of our own that we have to turn to the commercial debt market for government functions. There's been a restriction placed on our issuance of tax-exempt debt only for what they call essential government functions. If there wasn't that restriction, we would easily fit into the pool that is available for states and municipalities with the, I think it's Title IV, the Stabilization Fund. But without us fitting into that government pool and having that debt relief, there is starting to be some concerns already from banks around our inclusion on the business side of things. So we do need the ability going forward, and we're putting forward a proposal early next week on us being able to access municipal debt. I think if we're coming out of this crisis and doing the same things that get us in the same situations, I think it's a mistake for everyone. So we want to try to argue with what we can do going forward to fix some of these issues. And the issue you raised is a really important one for us to be participating in government debt markets, which is lower cost, longer term, and really can help to support our governments. When this comes around again, we want to be in a position to be able to be easily accommodated instead of being placed in a relief fund that is going to be really difficult for us to work through. And especially since we are not able to go through the bankruptcy courts, this is going to be really interesting for tribes to be able to work through their debt in a lot of industries like hospitality and gaming, which are going to be the last to recover during this crisis. This is, we can take lessons from how this is occurring in other parts of the world and see that this is going to be something we need to work out soon.
Thank you, Mr. Desiderio, and I'm pretty sure I'm way over my time, so thank you for your forbearance, Mr. Chairman, and I yield back to you, Chairman Gallego.
Thank you, Representative Cartwright. We now recognize Representative Soto for his 5 minutes of questions.
Thank you, Chairman. I want to start by recognizing a decorated Vietnam veteran, Don Osceola, who was a member of the Miccosukee tribe in my home state of Florida. He served in the Lima Company, 3rd Battalion, 9th Marines, 3rd Marine Division in Vietnam, and earned medals for meritorious service, including the Purple Heart. And he was known by many local tribes like the Seminoles and Miccosukee as the Little Audie Murphy because of his heroism. And he became likely the first Native American from Florida to die from the coronavirus. We see nationwide, our tribes, particularly the Navajo Nation, have been the most vulnerable. And we are here in this committee to right these types of injustices. But before I go a little bit more into a more broader question about the vulnerabilities that Native American tribes face, I wanted to start with a more specific issue that I saw just recently, that states like South Dakota have attempted to challenge tribes like the Sioux from having the ability to take quarantine measures like roadblocks. It'd be great to get more details on how this came about and how the Congress can help maintain tribal sovereignty to take necessary quarantine measures as you all see the need to do. And it'd be great to hear from you, Mr. Desiderio.
I think when you're asking that question, you have to, from the tribal side of things, you look at the history of disease with tribes that goes way beyond just this crisis. So the reaction of closing down your boundaries is a reaction to making sure your people are safe and having the knowledge that these things have happened before and have really devastated Native communities. So we see the difference between tribes that are trying to wrestle with this, and we have a lot of pre-existing conditions that make this a lot worse for the infection rates and the death rates for Native Americans. So the reaction to close your borders as a tribal government, as a sovereign, to be able to protect your people, I think it seems like a very logical reaction, and it shouldn't be playing out in the way where there's some adversarial relationship between the state government in South Dakota, or I should say the governor's office, and the tribe itself. The way we're seeing this is that the tribe is doing everything it can to mitigate and to protect its people. And I think that's a fundamental right that should be respected. And the communications, I think, probably work on those between the governor's office and the tribe. But I think I think they need to do what they can to protect their people during this, and use the context of history as a guide as well.
Well, please keep us posted. We'd be honored to help through this committee and otherwise to help you navigate with states that may not be as open-minded. And I'm glad you mentioned, again, we're here to help right injustices. We saw millions of Native Americans die over hundreds of years from disease. And so I think it makes perfect sense to be vigilant and to take measures needed to protect our Native American tribes from across the nation. So whether it's from pre-existing conditions or lack of immunities or not equal access to healthcare or technology, can you paint sort of a broader picture for us, Mr. Desidero, on why so many tribes remain so vulnerable and what the federal government's shortfalls in protecting the tribes have been to help finally fix these types of vulnerabilities?
Yeah, the vulnerabilities come. They're not something that just came about recently. This is from a systemic lack of funding and funding for priorities that are going to make a difference. We saw in the U.S. Commission on Civil Rights report that was titled Broken Promises Report, the idea that a lot of the infrastructure, when we're looking at telecommunications, we're looking at housing, the wait list to put in a new Indian school is over 50 years. How do we wrestle with these problems in a larger way? I think when we're looking at this in a piecemeal way, sometimes it gets very frustrating. These problems are really big. We're throwing a bucket of water when we're really looking at a swimming pool size problem. We need to look at this in a much different way. And, it goes to these recommendations of infrastructure. We're seeing this coming out of Congress, and it'll serve two purposes. One is we don't know how long this is going to last. So we need to keep preparing ourselves and look at these issues that have been spotlighted during this crisis. So if we're calling, the second thing is if it is lasting longer, we're going to need employment and jobs to pick up. So we need to start addressing those two issues. An emergency infrastructure provision would really help with that. And looking at, if we have the most crowded housing in the country, that's an obvious impact. If we have lack of telecommunications, our Native youth are going to be falling further behind when schools open up again. So if we're looking at, all of these infrastructure issues that are becoming really obvious and putting together something that looks at emergency infrastructure plan going forward, we need to be better prepared for the next time this comes around, whether it's an economic crisis or a healthcare crisis or anything. So looking at this holistically and actually looking at the problem for what it is and trying to do better at addressing this. It's unacceptable to have the lack of water or sanitation that's really proliferating some of the outbreaks in Indian country. So we need to take a different look at this in Congress and look at the Broken Promises report and what we can do going forward.
Thanks. And I know I'm near the end of my time, so I just wanted to ask one more question. I know the CARES Act did a lot of good, but there was obviously regulatory bureaucracy that's standing in the way of many of you receiving your money. How much does the HEROES Act improve upon it with the new parity that we see with both our tribes and our territories? How big of a step is this to help with this vision of a pandemic response and setting a precedent for an eventual national infrastructure package that you had just discussed in your last answer?
Well, the HEROES Act goes far in addressing a lot of these concerns. I would say the telecommunications piece and the telecommunications idea that Congresswoman Holland is raising is really a good thing. So we've tried this before on telecom on the last downturn, and it didn't work because the federal government saw to it that there was a commercial incentive for building out broadband across the country. That doesn't help with tribal governments. There's not an incentive to come into tribal governments. So we need to own the spectrum. We need to use it as an asset, and we need to build it out for the uses that the governments will be using. So this does take a step in that direction, and also has some other funding, for example, with housing and some other CARES Act funding for the relief fund for governments, which is going to help a lot. But in a cautionary note, if we're doing this and leaving it up to, we need more flexibility to be applied from the agencies to be able to do these other projects. It's temporary facilities are fine, but there's a bigger problem at issue with Indian country that we need to think about. But it does go a long way. There's a lot of considerations in the HEROES Act. And I think there's appreciation from Indian country that were included in so many different provisions. So it is a great start or good direction.
Thanks for your feedback, and I yield back.
Thank you, Representative Soto. Do we have any other members on the line? I want to make sure don't want to skip that. I apologize earlier, you were probably seeing the top of my head. I have a son that just had a huge meltdown at home. Luckily, my fiance is working with him right now, but age of COVID, you got to take care of a lot of the stuff. Okay, so if I don't see any other members, and if should any other members join us again, we could actually add them back into the queue for questions. So I'm going to go back around, and we'll have another round of questions. We don't necessarily have to stick to the time at this point, but make sure to at least be cognizant of our panelists, so make sure we don't grill them too much. Mr. Curio, I want to talk to you about a bill that I have introduced with Congressman Mullen of Oklahoma. And in particular, the bill extends liability protection to our urban health centers that our IHS facilities get if they stay on tribal land. Could you explain to those watching on Zoom, TV, YouTube, whatever it is, why that would be important, especially considering where we are right now in terms of the pandemic?
Sure, thank you. With coverage for liability, it allows us to use some of those funds that we now have to get to in the private market for medical liability coverage or malpractice coverage. But the flexibility of FTCA even addressing this crisis, I'll note that we are a HRSA-funded community health center as well. And one of the most immediate things that HRSA did was expand the authority of FTCA to provide for temporary clinics, to expand our scope of work to provide for testing services right away, which would have immediately been covered under the FTCA. In this particular crisis, that's not available to urban Indian health programs. Even if we wanted to do such a thing, it would be very difficult to go back to our insurer and negotiate this in the private sector. But those allowances happen, very quickly in this crisis. Ongoing, it would be very nice to have the FTCA, a really fundamental portion of providing care to urban Indians across the country, and with many of our programs, simply is a good offset to the ability to leverage our very limited funds. Almost, as Representative Holland said, the Indian Health Service receives about $2,600 per capita for healthcare, whereas the general population, it's about $10,000. For urban Indian health programs, that number is about $600 per person per year. And to add the burden of private malpractice insurance, it's just a burden that prevents us from the full range of services that we could provide.
Excellent. Representative Holland, do you have any other questions?
Yes, Chairman, I can ask a few if that's okay.
Yes, of course.
Thank you so much again for being here, all of you. And it's nice to see my colleagues as well. Mr. Desiderio, what would a more equitable or better formula structure look like for the Coronavirus Relief Fund? As Representative Gallego highlighted, or Chairman Gallego highlighted, this has been a huge barrier for tribes. Is there a better way to structure these relief funds for smaller tribes that have been left out?
Well, our initial response to this and letter of advice to Department of Treasury and Department of Interior on this was to look at what the legislation says. This was based on expenditures, and expenditures for us means the idea that tribes don't have the funding available to spend on existing programs and services, and it's also forward-looking in the idea that tribes would be coming up with the amount of money that they may need going forward to deal with this crisis. Each tribe is different. There are tribes that are going to spend an awful lot on mitigating or taking care of the health emergency, and tribes that are going to be looking at, well, we need to make sure we take care of the community and the communities that they serve. So looking at expenditures broadly, coming up with the idea that a baseline for expenditures for tribes, and being able to have tribes submit on whatever that baseline or those considerations were for expenditures, it would have met the intent of the law, and it would have also, I think initially there was an issue of, well, this might take a lot of time, but you see where we are now. This could easily have been worked through. So I think going forward, when you're looking at the legislation that's being proposed now in taking care of lost revenue, it's a very broad concept, and that would be taking care of the backward-looking revenue, and it would also be taking care of the additional expenses. The flexibility that should be applied for the agencies to distribute those monies should be opened, but mostly just looking at the law and saying this is the expenditures-based formula that should be applied. Equal weight should have been applied. The population funding makes sense. A lot of government funding is taken into consideration, but having that done without both equally considering the economic impact. Now we're at a position where you have 60% of the funds out, and two other factors that need to be included for the remaining 40%. So it's going to be difficult for tribes to be having their considerations equitably considered at this point.
Mm-hmm. Thank you. And I'll say that even if they're going to do it by population, they should do it correctly, because I understand that there were some tribes where they undercounted the number of members that they have. Yeah, and they didn't get the funds that they were expecting. So it looks like we have our work cut out for us. Mr. Murillo, the HEROES Act extends 100% to FMAP for 1 year to urban Indian health centers, but it has a 1-year sunset. Why is it important for these organizations to recover this coverage permanently?
Thank you for the question, Representative Holland. 100% FMAP has been an issue, or really an oversight, for a very long time. States have the initiative to expand or to use Medicaid and the 100% FMAP. In Arizona in particular has been a very leader in using the 100% FMAP to enhance the services under Medicaid to American Indian and Alaska Native Medicaid members. For example, the American Indian Medical Home here in the state provides for a rate on top of the all-inclusive rate to provide case management services. Those case management services could have easily been converted to contact tracing services, as we try to examine the relationship between families here in Phoenix and families on the Navajo reservation, for example. The back and forth that has been required to provide families on the reservation needed food and other things because of the isolation of their families up there. That in itself would have been a tremendous help going into the crisis, and having it permanently will enable us to provide those case management services in this state through that authorization.
Thank you. Thank you for that answer. And last question, Mr. Chairman, is for Mr. Alice. We've heard there are continuing issues at the CDC and FEMA that have left tribes behind, including lack of tribal consultation at the CDC and funneling FEMA applications through states. Do you suggest any action on our end, and you might have already addressed this in one way or another, to help facilitate these agencies' work with tribes?
Yeah, great question, Representative. Thank you for that question. So yeah, there's been a lot of challenges with that. Some are systemic and have hit Indian country for a while. And similar to a previous topic I mentioned around rural programs is a cost sharing mechanism, one, where there's a 25% cost share in addition to it being a reimbursement program. Those kind of two things together right now is an enormous burden. What folks really have to understand, and I know you all do, is tribes are really hurting because their revenues have disappeared, right? All their businesses are closed up, so they just don't have the kind of resources that other governments may have, because they have a tax base and Indian country doesn't for the most part. And so having this cost share, having it be a reimbursement program where you have to front the money is difficult. And consultation across the board throughout the administration is an issue. You know, being able to properly interact with the tribe to understand what the concerns are, what the nuances are with the communities, traditions and customs, all those kinds of things that decision makers need to have in front of them in order to tailor programs properly for Indian country in the intent that Congress wanted them to be helpful to these communities.
Thank you so much. Chairman, I yield. Thank you.
Thank you, Representative Holland. Do we have any other questions from other members on the committee right now?
Yeah, Matt Cartwright here. I have some more questions.
Go ahead.
Thank you, Mr. Chairman. And I want to thank our colleague, Darren Soto from Florida, for saying what really needed to be said about American Indian veterans of our armed services. Mr. Murillo, as you know, American Indian and Alaska Native people serve in U.S. armed services at a rate higher than any other group, and we honor their service. I do know, however, that there have long been barriers to authorizing VA reimbursement for services provided by urban Indian organizations. My question for you is, what problems does that create for urban Indian organizations, IUOs, and how can Congress remedy this?
Thank you for that question. In service to Native American veterans, I think, like all Native Americans, feel like they want to come to a place where they're comfortable receiving care. The idea of cultural competence really plays strong with our Native veterans. And yes, there are lots, and they do seek care at UIOs. Clarifying the legislations that allows for billing for reimbursement for the services to the Native American veterans would go a long way. As we thought we were in the original legislation, what we need is a fix for the VA to allow for third-party relief for that care received in urban Indian centers. And it's not just the medical care, primary care, and some specialty care that we provide. It's also a place where one UIO in particular is trying to arrange for the receipt of medicines to that address via the VA mail order program. So we're helping veterans in many, many ways, and it would be nice to be included in the arrangement that the VA and the Indian Health Service providers have as well.
Well, thank you for that. And my last question is for Mr. Alice. Thank you for your comments today, sir. My understanding is that there are concerns that substandard housing and sanitary facilities that have exacerbated the spread of COVID-19, as well as contributing to underlying health risks. Question is, what role would increased funding to meet housing and sanitation needs play in responding to this pandemic in Indian country?
Congressman, thank you for that question. An enormous role. I mean, you know, what's really noteworthy with this particular virus is that it's highly contagious. All right, and if you're in, you know, groups of people close together in any kind of environment, even a, you know, a really healthy, clean environment, bunch of people together is a risk. Okay, now you start propping up these issues that we're seeing in the country because of, just like how healthcare and infrastructure, chronic underfunding for housing, which is basically flatlined over the last couple of decades. It's no surprise that the housing conditions are substandard in Indian country. So when you have a lot of folks and families living in one household, overcrowded situation, as I mentioned, 8 times the national average, and then you throw upon, you know, bad water, you know, bad infrastructure within the house, molding, all kinds of situations and circumstances that create, you know, and add on to the problem with, you know, being, you know, having healthy environments caused by this. Is really a problem. It's a tinderbox. I've said that before. The health disparities coupled with the housing problem, this virus would thrive in that. And we are seeing that the Navajo Nation and other tribal communities across the country where it's catching on and in a very sad and scary way. And so we certainly hope that Congress recognizes the need for funding for housing and in order to make sure people live in healthy environments.
Well, thank you, Mr. Alice. Thank you, Mr. Murillo. Thank you, Mr. Desiderio. And I yield back, Mr. Chairman. Thank you for holding this hearing.
Great. Thank you, Representative Cartwright. And now we will move, well, actually, let me just make sure, Representative Soto, do you have any follow-up questions?
None at this time, Chairman.
Okay, great. Let's go back, and I'd like to offer our panelists an opportunity for them just to go deeper into whatever subject matter they want regarding what we've discussed so far on this panel, or other things they maybe did not have enough time to discuss. And we'll start in order with Mr. Alice.
Great. Thank you, Chairman. And again, like I said in the beginning, and I shared, all the panelists shared, is thank you for having this important meeting to discuss these issues. You know, bullet points. As Dante indicated, flexibility with funding. Really making sure that the agencies understand the need for flexible funding that is tailored uniquely for the situations that we see and experience in Indian country, and understanding that we really, you know, we want to at least maintain the status quo. But as you already know from our testimony in the back, the status quo with healthcare and infrastructure and housing in Indian country is, you know, really, you know, in a bad spot and not acceptable. We can't allow it to get worse and cause even bigger problems moving forward for these tribal communities if there isn't the proper funding across the board in that keeps tribal governments safe, that has housing safe.
And a lot of these different components that really make our communities or place our communities in a better position. So I also want to state that we're not going to do this with just congressional funding alone. It's never really enough. It's a pretty significant need. So we need capital incentives like the tax credits and tax exempt debt for those longer term projects to actually work for Indian country and for us to be included. and it's going to make a huge difference if we do. So we want to put forward those proposals as well. And we appreciate the Congress listening and hopefully applying a bit more flexibility from the agency side on helping out tribes. Thank you.
Thank you, and thank you to all of our panelists and to the members of Congress that have joined us today. I think this is not the most ideal way, obviously, to hold a hearing, but this is our best that we can to continue to do both our oversight responsibilities as well as to try to continue to push our trust responsibility to Indian country. And unfortunately, this pandemic has really shown a lot of frailties in our relationship with our Native American brothers and sisters in regards to how much we have, as a federal government, have let down Indian country, both in areas of health, in areas of consultation, infrastructure, everything that we on this panel and every member of Congress has been talking about for years is finally being, I think, shown even more so to the world now. And I really hope that we can use this opportunity to kind of continue to build a stronger Indian country with a more responsive federal government, so that next time we find ourselves in this situation, and unfortunately we will find ourselves in this situation, Indian country will be better prepared and ready to deal with it. And I think it was Mr. Desiderio who said he's sick of hearing that Indian country is resilient. And I understand your feelings there. Indian country, it cannot be just rely on themselves. It is our responsibility as Americans to take care of fellow Americans, and because we promised we would do it. And we need to fulfill that promise by empowering them and giving them all the skills they can to not just be resilient, but to succeed and thrive after that. Thank you again to all my panelists. Usually I'd say thank you for traveling to Washington, D.C. So at least this time we can skip that part, but thank you for your time. I certainly know how hard it is to conduct these over the internet. So I greatly appreciate it, and we will see you at our next hearing. Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.